My hospice family. Good evening, my hospice family. How you guys doing? Surprise! It is I, your favorite hospice nurse. Um, I just realized that I should have probably put a shorts, like I should have posted a shorts to have us come in, but it didn't happen. So let's see what YouTube will do. I am looking for at least 20 of us. Okay, I'm looking for at least 20 of us to be on this live today with me this evening. Mm, mm. This ginger tea is very good. Ginger and lemons. Okay, that's what I'm drinking. Let me know your favorite tea, guys. Mm, it's very good. Come on in, my hospice family. Come on in. I hope we're not all sleeping at this time, you know? All right. We are going to have a conversation about death and dying. Okay. Um, we are going to talk about why most people are afraid of death and dying. Okay. And this conversation, it's going to come from a hospice nurse, my experience as a nurse. It's going to come from my experience as a nurse, what I have experienced during my years in nursing. Okay, my beautiful people. So I am waiting for YouTube to gather some of us up. All right, where are you guys? I know it's late. I know I'm in bed, guys. I'm in bed, relaxing. Hello, my hospice family. Come on in. We are going to talk about death and dying. Okay, why are most of us afraid of death and dying? I know I haven't been on this channel for a while. I haven't been here for a few days, but I miss you guys. So I said, you know what? I know it's late, but I still want to come in. I want to come out and talk to us, okay? Hello, additional. Yay. Hello, Taisha. Hi. Come on in, guys. I know it's late, but we're going to talk about it. Master. Hey, guys. As you come in, please, I'm going to ask you to subscribe and give me a like. Okay, my beautiful hospice family. Hey, Trey, what's going on? Hello, Trey. You guys, Addie, additional, where are you? Where are you coming from? Thank you, Trey. Addie, where are you? We are in America, in the USA. Thank you, thank you. You guys, we're going to talk about death and dying. I'm a hospice registered nurse, okay? And I want to come in here today, this evening, okay? Although it's kind of late where I'm at right now. Well, not too late. It's about to be 10 p.m., guys. Hello, Audition. Oh, you're from the UK. I would love to go to the UK one of these days. Absolutely. But guys, for those of you who are new to my channel, I want to say welcome. Welcome to Duns Hospice. My name is Nurse Dawn. I am a hospice registered nurse, okay? And I want to talk to us about this very important topic, guys. Oh, it's 3 a.m. Oh, how come you're up so late? Additional, you should be asleep. Do you have work tomorrow? But I'm glad you're here with me this eve. Well, tonight, I guess I should say. Wow, 3 in the morning and you're up. Good for you. Are you working? Are you in the nursing field? Let me know. Because I actually used to work the overnight shift. When I started out in nursing, I used to work 11 p.m. till 7 a.m. Okay. So completely, I understand. Oh, your baby woke up. Oh, how cute. How old do you have a boy or a girl? Oh, that's so adorable. Well, stay up with me. I'm going to be up there for a little while. But yes, my beautiful hospice family, I want to talk to us about the reasons, okay? The reasons why we are afraid of dying. And this comes from a hospice nurse. Like, I'm a registered nurse, I'm a hospice nurse. I've been a nurse since 2012, okay? And I have walked into so many wonderful hospice families, hospice patients' homes, okay? Oh, that's cute. She's 6 months. I have a 10-year-old son at his additional. I have a 10-year-old son, okay? So I really miss when he was that tiny. Enjoy the moments. Enjoy the months. It goes by fast. But yes, my beautiful hospice family, most of us, the reason why we are afraid of dying, most people, okay, like when I take care of my patients, they say to me, they ask me, Nurse, is it going to hurt? You know, am I going to be in pain? Will I be suffering? So when people think about dying, like death and dying, they think that it's going to be this really like crisis, like this really excruciating pain that you're going to be experiencing. And I'm here to let you guys know because I have witnessed several people dying, and it does not hurt, okay? Like they're not in pain, especially if the person has been under hospice care for a long time. So basically, hospice care, guys, hospice care means that you have a terminal illness, okay? Your doctors say you have a terminal illness that has no cure, you see? And the best thing to do is to be home and be comfortable, is for us to manage your symptoms, all right? So this is when myself as a registered nurse, I come in, my colleagues come in, okay? So basically my patients say to me, Nurse, is it gonna hurt? Is it gonna hurt? Am I gonna be suffering? Am I gonna be in pain? I'm not going to be able to breathe. Yes, a lot of people think that when they're dying, like they can't breathe. And that's not the case at all. Um, Actually, from my experience, from what I've noticed, the patient just basically is sleeping, okay? Like your whole body will shut down. Your organs, your tissues, everything will slowly shut down. And you'll just go like in a you'll feel lethargic, okay, go into this deep sleep, you know? And hospice nurses like myself, we will keep you well medicated, okay? So when the patient is under hospice care, we keep you medicated. We give you medications to manage your symptoms so that you're not in pain, you don't have any difficulty breathing. And most of my patients, they're very comfortable. The family will say to me, Nurse, it was a peaceful pass. You know, it's a peaceful pass. So, usually they would just take a last breath, just, and then that's it. Okay. So that's the number one reason, from my experience, people are afraid of dying. You know, they are afraid of dying because they think that it's going to hurt. Like they're going to be in so much pain, so much distress, like the body's going to be really uncomfortable. And that's not the case. So that's why I strongly encourage us, if you find out that your mom, your dad, your grandma, your grandpa, if you find out that somebody you love, you're taking care of, has a terminal illness means that there's no cure for what you have, whether it's cancer, it's heart failure, dementia, kidney disease, whatever kind of disease that it is, that the doctors say there's no more aggressive treatment, I strongly recommend my husband's family. You get, you connect with a local agency. Okay. Connect with your local agency because people who are under hospice care, they have a peaceful past, because the nurse is on top of their symptoms. The nurse is on top of your medications. Whereas if you were to die at home, without any kind of nursing or any kind of, medical assistance, people to come into your home, that's when it would be more difficult. You know what I mean? So, yeah, so that's the number one reason. Now, let me know, guys, let me know out of you who's watching, are you afraid of dying? Are you afraid of death and dying? And what's the reason? Huh? Or what have you heard about death and dying that kind of got you to be scared? I would love to hear from you guys, okay? Let me know your experience, your thoughts. Like when you think about yourself as being old, because we all think of ourselves, as being, old. And, when we die, we're going to be really old. So let me know when you come, when you think about your turn, because we're all going to die, me, you, I, we're all going to go. When you think about dying, what comes to your mind? Huh? What thoughts do you have when it comes to dying? Let me know, my beautiful people. Okay, let me know. All right, guys. Now, so besides that, the second reason, the second reason, I'm just going to talk about two, okay? Because right now it's late. I have to go to bed. I have to go to work in the morning. All right. But the second reason why from my experience of being a hospice nurse since 2012, the second reason is because, hold on. Let's see. Taisha says, I used to fear death. The reason was how I would go. How do you choose the best hospice care team? Very good question. Very good question. Um, was how I would go. Well, first of all, I am glad that you are no longer afraid of death. That is very good thing because I know most of us we are afraid of death, but I'm glad that you're not. And the second part is how do you choose the best hospice care team? Well, it all depends. It depends on, do you want a big company or do you want a smaller, more intimate company? Because from my experiences, the bigger hospice companies, like, say the agency has over 200 members, okay, like have over 200 patients. If a company has over, 200 patients, it's considered to be a big hospice agency. All right. And these agencies, they have more, I want to say more like technology, like, more machines. Like, for example, like a machine pump, there's just going to be more services that's available to you. But at the same time, if you go with a smaller agency, you might feel like it's more intimate. The nurse or the social worker might have more time to spend one to one with you, but they may not have as much technology, as much of the like machines, certain, like, there's a thing called the CAD pump, which is like a pump that gives you medication throughout. So if you are somebody, or if you know a loved one who has cancer and they're in a lot of pain and they need a lot of, like medications to manage their symptoms, I would say a bigger company is better. But if, the patient is, like a dementia patient, Alzheimer's, like your little old ladies, that doesn't have any real crucial pain to manage or any real um like long-term symptoms, then I would go with a smaller company. But when in doubt, I would definitely interview. interview a big company and also interview a smaller company so that you can get the feel for it, okay? So it's really up to you. Just do the research. Do the research. There's so many hospice companies out there, but I would at least interview at least two or three, and out of which make sure it's one that's a big one and one that's a smaller size. Okay, smaller size would be anything that has like 50 or less patients. Okay, 50 or less patients would qualify as a small hospice agency, and anyone who has like, you know 100 plus, I would say that's a big hospice agency. But that's a very good question, Taisha. Thank you so much. Okay, so the second reason my hospice family, that members, that patients, okay, that families are afraid of dying, okay, that people are afraid of dying. The second reason why they are afraid of dying is because they have a lot of unfinished business. Mhm. The second most reason why we are afraid of dying is because we feel like we have not fulfilled our purpose on earth. We have not done all of the things we wanted to do. Hmm. Talk to me, my beautiful people. Talk to me. From my experience as a hospice nurse, because I take care of people who are dying every single day. Those of us who have lived a fulfilled life, like for example, you know if you are dying and you are surrounded by your children, by your spouse, by your grandkids, your great grandkids, if you were able to work in the career you wanted to do, have the kind of business maybe you wanted to do, travel, maybe you wrote a book, you know, like you had a fulfilled life. Then these people, my beautiful hospice family, these kind of people, they are not afraid of dying. Whereas the opposite, if you are somebody with regrets, okay, and you feel like there's so many unfinished business that you did not get a chance to do, then these kind of people are more likely to be afraid of death and dying. And that's why I encourage us here in this channel to live your life to the fullest. Okay, my beautiful people, live your life to the fullest. Because if you don't live your life to the fullest, if you don't do things you want to do, if you find yourself living for other people, if you find yourself pleasing other people, then it's going to be really hard at the end of life. You are going to feel like, oh my goodness, now I'm dying and I did not complete not even half of the things I wanted to complete in my life. So that's why it's really important while you are alive, while you are healthy, ask God. Ask God, what is your purpose here on earth? Ask God, why did you bring me on earth? Why am I here? What did you create me to do? What is, the what's the job that I was put on earth to do? Who am I supposed to reach? Whether you are reaching one person, whether you are serving, 10 people or 10 million people, it doesn't matter. But you need to walk in your purpose, my beautiful people, because those of us who has had a fulfilled life, they're not afraid of dying. Mm-mm. You know what I mean, my beautiful hospice family? So those are really the two main reasons why people are afraid of dying, from my experience. There's a lot more, and I'd love to hear from you, but that's what I wanted to talk to us about. You know? Additional, are you still here, my girl? Or are you asleep now? Did you go back to sleep? Is the baby asleep? That's so cute. But yes, my beautiful hospice family, um, so basically what I want to say to us is this, okay? Live your life to the fullest, all right? Live your life to the fullest. Not only that, get yourself connected with a hospice agency, okay? Because the nurse will come into your home every single week. And I think I have mentioned this, but my father, my own father right now, he's on hospice, you know? And actually today I spoke to his nurse, like me and his nurse and also the social worker, we talk like we're always in communication. And like it's so much easier when you have help. It's so much easier because you don't have to do it alone, my husband's family. If you find yourself being a caregiver of somebody who's dying, or even you, if you have been diagnosed with an illness that has no cure, connect yourself, okay, with with a hospice agency. Reach out to your hospice nurse because the more the more help you get, the easier it will be at end of life. It's going to be a smooth process. You're not going to be in any pain, any suffering. The nurse will come into your home every week. Sometimes the nurse could come, every day to make sure that your symptoms are managed, to make sure that she is on top, she's ahead of your symptoms, so that at the end of life, it's going to be a peaceful, peaceful pass. Okay, my beautiful people? Oh, that's a great question, Taisha. You want to know what made me choose hospice? Oh, okay. Well, I've talked about this in other videos, but I'm going to share again because that's a very good question. To all of my new supporters, my new subscribers, okay? The reason why I chose to become a hospice nurse, um, it's actually quite simple. So when I first started out nursing, I actually started out as a rehab nurse, okay? I was a floor nurse. So, myself as a floor nurse, I would always see the hospice nurses. My I just got an alert. Can you guys hear me? My alert just came on. But yes, so as a hospice, as a floor nurse, I would see hospice nurses coming in. They would come in and see the patients. They would spend like 30 minutes in the room with the patients. Sometimes they could even spend like almost an hour in the rooms with the patients. And then me as the floor nurse, I would be assigned like 10 people, for example. Okay. So I'm like in and out, in and out. Like I have to go to this room, to that room, to that room to take care of the patient. So I never really got a chance to know my patients intimately. Like they were just a number to me. You know what I mean? Like I was just, giving medications and doing treatments, and that's it. Whereas the hospice nurse would come into the rehab hospital. She would just, be assigned. She would just come to see that one person, okay? And she'll just sit there and be with that person. She could go through the medications and she would make recommendations. And also my husband, and also Taisha, like whenever a family member had any questions, they would always say to me, well, did you call the hospice nurse? What does the hospice nurse say? And I'm like, wait a minute, I'm here with your mom all day. The hospice nurse comes in for an hour, but yet she has more, like they value her opinion more, because the hospice nurse, her specialty is death and dying, whereas me, I was a floor nurse. And not only that, but I didn't have time to really, dedicate to the one person. And so I really got curious, And I was like, wow, that is excellent. Because, as a nurse, I like to be able to spend time, really get to know my patients. And I did not want my patients to be just like a number to me. Like I really wanted to know them intimately. And not only that, but the hospice nurse, she also had a nice intimate relationship with the family members, with the caregivers. You know what I mean? And then oftentimes too, even the doctor, most doctors, guys, they don't know about death and dying. Because think about it, doctors are trained, doctors were trained to treat, right? Doctors were trained to make you feel better and then to have you go back to the world. Go back to to your baseline, to how you were. So even the doctors would, you know, basically ask me as a floor nurse, "Oh, what medication did the hospice nurse recommend?" You know? So once once the patient is under hospice care, every single question basically goes through the hospice nurse, you know? And so I was like, wow, that is really special. Like I really valued that. And I felt like the hospice nurse, she is contributing a lot more to her patients than, being a floor nurse. Because a floor nurse, like I said, you have 10 or more patients to take care of. So you don't really have time to really dedicate to one patient. You're just really just in and out, just going all around. It's really chaotic all day long, you know? And not only that, I'm very comfortable with the elderly population because I was raised by my grandmother. So when I'm around old people, like older people, it's really soothing to me. I know it may sound weird, but it's really therapeutic and soothing to me. Like I love being around older people. Like I feel like it reminds me of my childhood, of my upbringing, being around my grandma. All right. And not only that, but as a hospice nurse, you really get to teach. A lot of it has to do with teaching and, being emotionally supportive to the members, to the family, okay? Holding somebody's hands, guiding them in a respectable manner. Like we're not here to take over, but it's a lot of teaching. It's very emotional, and it's like closest it's a part of nursing. You either love it or you want nothing to do with it, you know? Because you come into the person's world at a time when they are so vulnerable, you know? Because like I said, most of us know about how to get somebody to feel better, but we don't know what to do when we have a family member who's dying, you know? You say it's like having a professional be your advocate in the topic of care when the patient or the family might not be able to speak. Exactly, Taisha. That's exactly what it is because this might be your first time. This might be your first time dealing with somebody who's dying. But myself as a hospice nurse since 2012, I've seen I've seen hundreds of similar situations. So definitely, I am an, advocate to you, you know, like we we manage the medications, we go through your whole list of medications, okay? We make recommendations, like we tell the doctor, okay, maybe we should discontinue this. Maybe we should increase this volume. Maybe we should decrease this amount, this dosage. Okay? And then we also teach the family about the signs and symptoms to look out for when somebody's dying. Like, for example, they're not going to want to eat. Like when we are dying, we have no appetite. We don't want to eat. We sleep more. They're more confused. Sometimes they get more anxious. Okay. Yeah. So these are all things that we advocate for. And not only that, but we also get the family equipments, medical equipments for free, such as a hospital bed, a wheelchair, bedside table. Okay. All of these things, the hospice company can get it to your home within 24 to 48 hours. Whereas if you were by yourself, you would have to most likely buy these things, or rent them. But if somebody is under hospice, it's free. It's free, it's free. But these are some great questions. Thank you so much. But guys, it's getting late and I'm tired. I'm sure you guys are tired too. But thank you. Thank you so much for being here with me. Like I said, there are more reasons why we are afraid of death and dying, but these are the two that I wanted to talk to us about. Okay. Um, but because I haven't been on this channel, because I have two YouTube channels, guys. So I haven't been on this channel for a few days. I said to myself, I don't care if I don't have my hair, my makeup on, I'm just gonna come out here and give you guys some love. Okay. Thank you so much, guys. Thank you for being with me. Okay. And I'll see you next time. Please, of course, subscribe, follow. Let me know if you have any questions. Okay. I love you guys. I love you guys with the love of Jesus Christ. I pray that you learn something from this video. Okay. I'll see you next time, guys. I love you. Take care. Mwah. Good night.